Now, another concern that you might have heard about with aluminium-based antiperspirants, this one's not as popular as the breast cancer myth, but it is an increased risk of Alzheimer's. This stems from a study done back in the 1960s, where they found high levels of aluminium within the brains of patients with Alzheimer's. However, later research debunked this, as they found that these aluminium deposits were as a result of the disease, not the cause of it. The Alzheimer's Association and the World Health Organization have both stated that there is no conclusive evidence linking aluminium exposure and Alzheimer's disease. So if you're using an antiperspirant with an aluminium salt, you don't need to worry about a breast cancer risk or Alzheimer's disease. Now, whilst we're talking about aluminium, I really want to go into more detail on aluminium salts. They contain aluminium chloride. This is a very potent aluminium salt. And you might have also heard of things like aluminium sesquichlorohydrate, or like in our deodorant and antiperspirant stick by SweatBlock, this one contains aluminium zirconium tetrahydrochlorex GLY. It's a very hard one to say. So what do we mean by these salts? It basically means compounds formed when aluminium reacts with other elements, such as chlorine or oxygen, basically making it more stable. So like I said, aluminium chloride, it's the most potent aluminium salt, and it's in our SweatBlock wipes and in our SweatBlock roll-on, the clinical strength ones. And they're generally applied once a week, and they last for about 7 days. So because they're potent, we apply them once a week and at night time. The aluminium chloride, because it's more potent, it does sometimes cause a bit more sensitivity compared to the less potent aluminium salts. So it's always good to do a little patch test before using it. Now, for daily use antiperspirants, for example, our SweatBlock Clinical Protection Antiperspirant and Deodorant, this contains a less potent aluminium salt. So remember the long name, aluminium zirconium tetrachlorohydrate GLY. Because it's less potent, it's generally better tolerated and causes less sensitivity. So you can use it every single day. And so you can use it in combination with aluminium chloride. Obviously, the aluminium chloride, like the SweatBlock wipes, for example, you'd use that at nighttime once a week. And then in the day, you'd use our SweatBlock Clinical Protection Antiperspirant and Deodorant. And also a pro tip that I always like to tell everyone and all my patients, with any aluminium salt containing antiperspirant, it's always best to use on clean, dry skin. Basically, if your skin is wet with water, it can increase sensitivity with any aluminium salt. So it's really important to apply it on dry skin. Also, especially with aluminium chloride, please do not apply it straight after going to the shower. Your pores are open, your skin's warm, it's going to cause a lot more sensitivity. So this one really needs to be on cool, dry skin. SweatBlock, sweat less, live more.